So first, thank you all for registering for today's talk, COVID-19 Licensing Guidance for Childcare Providers. Here in a moment, I'll be handing the reins off to our licensing guest speakers. First, however, I just wanted to handle some housekeeping. So due to the high number of RSVPs, we are co-broadcasting the talk today on both Zoom and on the Early Learning Ventures Facebook page. We will have ELV team members monitoring the chat feeds on both Zoom and on Facebook, and then pushing over to me. So please ask questions as they come up, but please note that we received over 50 questions before even starting, so we won't be able to cover everything. Oh, I suppose I should introduce myself. My name is Michael Taylor, and while I typically serve as ELV's Membership Development Supervisor, today I'll be serving as your chat moderator. Now, we also have a large number of providers on this talk who use CORE, which is ELV's Colorado-focused childcare management system. And so I wanted to update our network on two things. First, as many of you may have heard or seen, we recently implemented a QR code scanning feature on our apps to allow parents to perform touchless sign-in. We have instructions for you for your parents in both English and Spanish available, so please just write client support if you'd like those. The second one is one that's not been announced anywhere, and it's really, really exciting. So thanks to a generous donation from our funder, we're going to be able to scholarship our network for another month. So June will be free, and you'll hear about it more officially in the coming days. For those of you not in the ELV network, we've offered our shared services resource platform out for free to all Colorado EC professionals for the rest of 2020. You'll get a link where you can sign up along with today's recording and slides, all about an hour after this webinar ends. But I don't want to take up too much more time on my end, so let's push on to today's speakers. We're lucky enough today to be joined by three members of Colorado State Licensing. Carin Rosa, who serves as Director of Childcare Licensing, Deborah Gray, who serves as Quality and TA Program Manager, and Tanya Estrada-Trujillo, who serves as the Licensing Operations Program Manager. They'll be walking through the current guidance for childcare providers. So, Carin, Debbie, Tanya, please take it away.
Thank you, Michael, and good morning, everybody. This is Carin Rosa. I'm the Director of Childcare Licensing, and like Michael said, I'm joined by both Debbie Gray and Tanya Estrada-Trujillo, who are program managers with the licensing unit. Next slide, please, Michael. The first thing I wanted to speak to everybody about is the Office of Early Childhood developed a status portal for programs. It is really information in these times of emergency that helps us address the critical needs and determine the state of providers. And so we encourage all programs, if you have not yet done so, or if you have updated your status, to go in and register your status with the department. When you enter your license number, it will get you started associated with the email address that we have attached to your license. And then you can update your status on this portal as much as necessary. So it has information on there that lets us know about necessary supplies you may need, about what slots you have open, if you have staffing issues. It really is helps inform the supply of the childcare that's going on. Now, it does not require you to participate in any emergency childcare or some programs have made the difficult decision not to operate at this time, and we understand that. And so, that's each business's decision to do that, but we would like to know what your operating status is. So we just highly encourage you to go ahead and register your status. And if your status changes, you weren't open like in the stay-at-home orders, and you're now deciding to reopen during safer at home, please go ahead and update your status with us. It really does help the department make decisions about where we can support you with funding, and also where we need to really push to help to build supply where there's demand in communities. So we would appreciate that.
Yeah, Carin, this is Debbie. I was just going to say that our resource and referral also uses this data, and so it's very, very helpful for them when they're trying to find childcare for families.
Yes, absolutely. So, and like I said, you can update, whenever your status changes or if slots open up, you can go in there and update this as many times as necessary. Next slide, Michael. Okay, when you update that status, you also, we sent out about 1,200 letters to programs that had told us they were operating with supply letters from the department that you could take to your local grocer, Sam's Club, Costco. And now it doesn't guarantee that they will let you buy supplies past the rations for individuals, but it is a letter from the department stating that you are considered essential and that you are trying to provide care for essential workers, and to ask them to allow you to buy supplies past those rations. It really is up to that grocer or entity to whether they're going to honor that or not, but it's something the department did to try to get you some support with buying extra supplies. If you did not receive one of those letters, if you go onto that status portal I just talked about and update your status to "you are now open," then you can also, there's a link to our Office of Early Childhood email box that I will go over later in the presentation, that if you email them, we can get you a copy of the supply letter. But it's important that you first update your status to make sure that it shows that you're operating, and then we can get you that supply letter. Now, I want to also say how much we appreciate those of you who have remained open and trying to care for these children during this very challenging time. We really appreciate you, and those that are deciding now to reopen, we really appreciate your commitment to these children and families. And I want to just say, you guys are the most prepared and the most trained to be able to deal with the challenges that these children and families are facing. You guys are trained normally in things like standard precautions, which I would like to say now is available for free on the Professional Development Information System. And in the slide deck, there is a link to where you can find that training, but it is now available for free, both in English and Spanish. And then I want to also say that you're definitely trained in health and sanitation practices. You guys have to typically perform these type of health and sanitation practices. So you guys are, in a great place to try to provide these services. And also for childcare centers, I want to make sure that you know that you can rely on your childcare health consultants. They have been receiving really good training and information, and they can do virtual consultations. So please make sure that you're reaching out to those childcare health consultants if you have any questions or concerns.
And that is a question that we have answered really frequently about the childcare health consultants. And if you're temporarily closed, licensing does not require you to have a visit with your healthcare consultant. But it is really good practice once you're going to be reopening, and we'll talk about this in a little bit, but to contact not only your licensing specialist, but also your healthcare health consultant.
Yes, and they can help you through the process of that reopening. And Healthy Childcare Colorado, one of our wonderful partners, along with some guidance from CDPHE as well as the licensing unit, they developed a really wonderful toolkit. Also, the Office of Early Childhood will be, Debbie will talk a little bit more about this later, but we will also be putting out some guides and information to help programs. The next piece I wanted to talk about that the department has done to try to support programs in partnership with Healthy Childcare Colorado and the Colorado Department of Public Health and Environment, as well as Early Milestones. We worked in concert to, and I'm sorry, it's Early Milestones in Healthy Childcare Colorado, that we worked in concert to develop a temporary employment opportunity for providers. So we have a temporary employment job board that is housed through our wonderful partners, Healthy Childcare Colorado. You can contact, if you are a professional that has, your program is not currently operating and you would still like to provide childcare services and would like to work in a temporary capacity in one of the programs that is continued to operate, the Office of Early Childhood Licensing Unit developed an online verification process for those professionals that can't currently work in their normal program and would like to work in these temporary capacities in programs that are operating. We've created an online verification process for you where we can track your background checks. We can ensure that you have the required trainings and that you either have documentation that you meet the qualifications for an early childhood teacher, assistant early childhood teacher, director, whatever it is that you typically work, what capacity you typically work in. We'll verify your qualifications and as well as that you have the required trainings, and we'll be able to track your background checks temporarily to another place of employment until your typical employer opens up. So I put a link to where you can find information on that. Once the individuals go through that process, then they will be given access to the job board that's housed on Healthy Childcare Colorado, where these temporary position postings are. Then it will be up to that individual to look at the postings, and then they can make a employment decision based on those where they would like to work, and then they will notify the department once they get a temporary position so we can start tracking the background checks to that employer. And then that will go, this is just a temporary process until the end of the COVID pandemic. So this is not, I want to be clear, this is not a process. If your facility has closed, is not going to reopen, has closed permanently, or if you're looking for individuals that you want to hire full-time, not in a temporary situation, this is not for those type of employment decisions. This is truly for if you have a temporary need based on COVID, and it's to help fill that staffing need. So Debbie, did you have something else you wanted to say?
Oh, I was just going to say how excited we are about this project. And I think as of today, we've probably given out 10 or 11 verification letters is all. We've had maybe 20 applicants. And so we're working on verification of qualifications, which thanks to our PDIS, our Professional Development Information System, we're able to get on there and pretty quickly look at your trainings and even look for some of us that have credentials. So it's a pretty quick turnaround that we can get you a verification letter and hopefully get you re-employed and get the background check shared.
Yes, and I'd like to just shout out again to our wonderful partners who worked on getting this up and running. It was a wonderful undertaking that they did on behalf of programs, and that was Healthy Childcare Colorado and Early Milestone. So thank you to both of them for helping us with this. Okay, Michael, next slide, please. Okay, and I want to start out by saying this. So I'm going to talk about group size and social distancing, and I want to be clear that everything that's in the public health order and the executive orders for safer at home is not under the oversight of licensing. So those are laws that licensed providers have to adhere to, but they are not governed by childcare licensing. So we have no ability to waive any of those requirements. It is not licensing that's making those requirements. It really is part of both the executive order and the public health order. So I just wanted to be very clear about that yes, our programs have to comply with those, but it is not a licensing requirement. I'm going to go ahead and speak to the group size and social distancing. So it still is right now through Safer at Home, a maximum consistent group of no more than 10 children. And you can have the amount of caregivers with those 10 children that it takes to meet the staff to child ratios for licensing. So you do not have to count those staff members that you need to meet staff to child ratios in licensing. It is really the 10 children that you have to count. So maximum consistent groups of no more than 10 children. And those consistent groups have to remain even in periods of low enrollment, in the beginning and ending of days. It really is to minimize any interaction between groups. So you can't combine groups at any time. They really want day-to-day consistent groups of no more than 10 children. With social or sometimes you'll hear it as physical distancing, but that is a required 6 feet to the extent possible. So you want to make sure that you're not only 6 feet between children, but if you have a large enough room based on square footage and you can meet the social distancing requirements for more than one group, you can have more than one group in a room, but you have to meet square footage and social distancing requirements within each group and between each group. So that means you would need 6 feet between the children in a consistent group of 10, as well as 6 feet between if you have another group of 10 children that have social distancing of 6 feet. Your licensing specialist can help you provide technical assistance to see if you have spaces big enough to the square footage will accommodate more than one group. So please, if you think that you do have a space that you can have more than the 10 children, work with your licensing specialist and they can help you, but you do still have to meet the public health order. This is not a licensing decision. We don't have ability to waive this. It is both in the executive order and public health order that mandates the 10 children group size and the social distancing requirements. So you have to meet both those things in order to have more than one group in your space. This includes outdoor space. So if you have a large playground and you can accommodate more than one group on that playground, they just have to have the social distancing requirements between the two groups and between the kids within those groups. So based on what your square footage is, how big it is outside, you may be able to have more than one group use the outdoor facilities at a time as well.
And Carin, I just want to chime in really quick that not only do we want you to check with your licensing specialist, but you also need to work with your local health department before you can add additional groups into one large room. So make sure you check with both partners at this time.
Yes.
And since since we're talking about playgrounds, we get this question a lot, so I thought I'd just slip in the answer real quick here. A lot of providers are asking if they have to disinfect the playgrounds between use or at the end of the day. So I did check with CDPHE just to make sure. And at this point in time, it is not a requirement to disinfect your playgrounds. Of course, we want to continue the social distancing, but it's not a requirement right now for disinfecting.
Thank you, Debbie.
Sure.
And then I also wanted to speak about adding additional rooms or spaces. So a lot of programs have spaces where typically they don't have a group of children assigned to that space, but they may use them as like a multi-function room or a gross motor room, or they have like a music room or an art room or any of those spaces that licensing has approved for use, but you don't typically have a group of children assigned to for capacity. To help maximize your ability to care for kids with the maximum group size of no more than 10 children, licensing can go ahead with your request. You don't have to send in a change request fee. You know, we can, with your just request, a written request that you'd like to now place children in those additional rooms or spaces. If licensing's already looked at them and approved them for care, for use, then we can go ahead and get those approved right away without, you know, like I said, you don't have to put in any fee or anything like that, just with a written verification from you that you'd like to now care for kids within that space. And then if you have additional rooms or spaces that you haven't previously had licensing approved and would like to now use them to care for children, then still you do not have to put in the change request fee. You can ask for that change, and then licensing will work with you to try to approve those spaces as quickly as possible to add additional, you know, to support you to add additional groups of children. So please reach out to your licensing specialist if you have any questions or concerns with that, but we are trying to temporarily approve those spaces for you to use them during the COVID-19 pandemic. Now, if you have rooms or spaces that you are going to use on a permanent basis, it's not just to meet the social distancing or group size requirements right now through the pandemic, those you would need to follow the normal licensing process by submitting a change request and the required fee. So if it's only temporary for the COVID pandemic and to meet the group size and social distancing requirements, we will do those without a fee. But if it's really you're adding additional spaces that you're going to be using permanently, then those would have to go through the regular process.
And Carin, I just wanted to kind of reiterate what you said earlier, because we get so many questions from providers wanting to know when this limit of 10 is going to be lifted and if it's going to be changed. And Carin said this earlier, but I just wanted to explain again, it's not a child care licensing requirement. This is coming from the governor's state order. And so of course, when this changes, we will blast it out to everybody as quickly as possible. We definitely know the ramifications that this has on child care businesses, but we're all in this together, and so we're waiting for further guidance ourselves. But when we know that, we will definitely communicate that as quickly as possible.
Yes, and thank you, Debbie, because it really is, it is not anything licensing can waive or you know, issue an emergency waiver for, or it really is law based on both the governor's executive order and the public health order. So you know, you have to adhere to those, but yes, if and I wish I had a crystal ball to say when this was all going to end. I think we all do. We just don't know. And so as soon as we have information, and I just want to be very clear, we do not have any additional information. We are communicating that out to our providers as soon as we have that information. So it's not, you know, I don't have any insider trading information for you. It really is, as soon as we get any new information, we're getting that out to programs as quickly as possible. So we appreciate, you know, how challenging this is on all of you, and that's why we're so grateful for those of you who have remained open, and we want to try to do what we can to try to support you. So mask guidance, again, this is really governed by the executive order and public health order. It's not a licensing requirement, and it is not under our jurisdiction or purview. So, but we can certainly talk about it, that of course in childcare facilities, we've said no masks for children under the age of 3, no masks during nap time at all. For those 3 to 5-year-olds, really, they need to be supervised. And please you know, be evaluating the appropriateness of the mask for those kiddos. So if you see children that are truly, you know, they don't know how to take on and off a mask, they're pulling it on and off frequently, they're touching their face frequently because they don't like the mask, then that should be where you're really evaluating whether the mask is appropriate for that child. So, you know that you have the ability to evaluate the appropriateness of those masks. If they can wear them, they're required to wear them, but we understand that with young children, that's not always appropriate. Also, you know, with the appropriateness of masks, it came up in questions whether licensing would be citing for the social distancing or mask guidance if your licensing specialist came out. These are not licensing violations. So obviously your licensing specialist can provide support and technical assistance and try to help you be in compliance with these requirements of the public health order and executive order, but we are not citing programs. They're not licensing violations. Now, if a program's really struggling, then it would be up to that local public health agency or the Colorado Department of Public Health and Environment would be enforcing those public health orders. So I just wanted to make that clear that your licensing specialist is there to help guide and support you. They would not be providing licensing violations if they go out and see that you're not meeting those requirements. So also I wanted to say we provided a link in here that it's to the CDPHE guidance on facial coverings. And so also the tips for helping children adjust are available, and there's a link to that on this page. So we understand that it could be scary for children to wear masks or see their adult caregivers wearing masks. And this is just a challenging time for children in general. And so we do have some tips for helping children adjust to the masks available, and I have put a link to that there. Next slide, please. I just want to say, you know, the best way that programs can make sure that they're keeping children and families safe is to look for all the up-to-date guidance, both on the Office of Early Childhood website. We have a web page that is just for COVID and COVID frequently asked questions and resources, as well as the Colorado Department of Public Health and Environment. I put a link to their COVID page, and they have a whole sections that is based just for schools and childcares. And so there's a lot of great resources and the current information. So you always want to be checking those frequently. There's a lot of information on both of those that will help guide providers in opening up their childcare and operating during this COVID pandemic. And also, you know, it protects you and your families by making sure that you're operating within their guidance. Debbie?
Just gonna say, hopefully you've also signed up to receive our email blast. So when things change rapidly, like we've experienced the last couple of months, we do have emails that we send out to quite a few providers. And so you want to check our website and sign up to be a part of those email blasts if you're not.
Yes, absolutely. Okay, and next page, I think we're going to cover some questions that came in from you guys next. If you go to the next slide, Michael. Oh, sorry, two other updates first. So the Emergency Child Care Collaborative will be ending May 24th. The enrollments into that program ended on the 17th. So there are no, you know, we're not accepting any future enrollments. It will be ending. So the payment piece of the Emergency Child Care Collaborative that ends May 24th. I want to be very clear, that doesn't mean childcare ends. People have been very confused. The Emergency Child Care Collaborative gave tuition grants to pay for tuition during that program. So childcare, you can still find childcare. Our resource and referral and early childhood councils can help families who need to find childcare. We're trying to we're sending them updated information on programs that are telling us on a daily basis we have more programs opening up. Also, licensing began doing original inspections for all programs this past Monday. We had just been doing them for emergency child care providers in order to support those programs who remained open, and but now we are completing original inspections for all programs. So there is care being created, you know, new supply being created all the time, and we're updating those resources and providing them to the early childhood councils and resource and referral. And also the department is working hard to try, we know that there's, you know, a great demand for school-age kids for this upcoming summer. And so we're trying to help build supply in those areas as well. And then you can always find information on our frequently asked questions about anything that new guidance on emergency childcare. Also, CCAP, I am not the CCAP expert, but OEC periodically updates the summary of counties' policies regarding CCAP absences and parent co-pays. They've done a lot to try to support families during this time with, you know, creating more lenient absent policies and parent co-pay practices. So if you go to this link that we provided here, it provides the most current information and CCAP updates. Next slide, please. And I believe this is our question slide. Yes. So I'm gonna go over a few questions that came in. Some of your questions that you had on there really are more for the Colorado Department of Public Health and Environment or your local public health agency to answer. And so I'm gonna concentrate on the ones that childcare licensing that we can answer, that are under our purview, or that we have really good guidance from CDPHE to answer. So I'm going to start by answering those questions, and then if we have additional time, we may be able to get to some from the chat box. So we had questions coming in about if it was better to like keep siblings in together or put them in different classrooms. So you still need to follow all licensing rules. So the ages of children, your ratios, none of the health and safety information has been waived. The things we have done to the support program is we have granted 120-day extensions for your training, CPR, first aid, medication administration, your children's health and your staff health statements. We've given you 120-day extensions from the expiration of those trainings. So that information is also part of those frequently asked questions on our website, but we have done that in an effort to support you during this pandemic. But all other health and safety and licensing requirements remain in place. It's very important during this time not to relax health and safety requirements. So your licensing rules still remain in place and you still need to adhere to them. If you have very specific situations for your program, you can absolutely reach out to see if it's appropriate for a temporary waiver. An emergency waiver can be granted, but those are evaluated in a case-by-case basis. And it really has to be a hardship for your program to meet something. And just to be clear, we cannot waive any of the public or executive health orders, only if you had another licensing rule that was creating a challenge specifically to providing care during the pandemic. Some of those we can look at to grant emergency waivers. So we also have had questions, and I think I covered it a little bit, about if you can combine groups at the end of the day or periods of low enrollment. Due to the public health order, you cannot combine groups of children even during periods of low enrollment. It really is to protect the kids and make sure that they stay with that consistent group that they're assigned to. The same thing, you want to try to be conscious about making sure the staff that are assigned to those groups remain consistent to the extent possible. We know that you'll have, you know, breaks and lunches and things that you have to do. And so as much as programs can try to assign the same staff members to that group of children on a consistent basis to the extent possible, that's what we're asking that you do, and not combine any groups. And I did cover licensing is not citing public health orders. So that was one thing that came up about, like, right now you're not allowed to use soft dolls, puppets. It would licensing be citing you if you had a lack of materials because you aren't using these things? Licensing is not going to be citing you because you're complying with public health orders. So we know that there's challenges, and we are going to try to be as supportive as possible of our programs. We know that you guys are under great stress and have a lot of challenges right now, and are trying to do the best possible during this pandemic. So anything that's created a challenge for you based on you complying with public health orders, we will be not, licensing is not going to be citing you because you're actually following what is now law with those executive and public health orders. And then a lot of questions came in about, you know, when will the group size of 10 go away? When will we be able to have larger groups? So I think we addressed this earlier, but just to reiterate, this is not a licensing, you know, something in the licensing purview to make that decision. It really will be based on the executive orders and the public health order that right now mandates the no more than 10 children. So like we said, as soon as we get any additional information, we will get that out to programs as quickly as possible. But you know, we really just don't know when that will happen. And then the next one, so we had a few questions came up about emergency drills and whether you were required to still do those and how does that work. Unfortunately, emergencies don't go away even during the pandemic. We've already had a couple of fires in some of our mountain communities. We know that those things, you know, tornadoes, fires, floods can still happen even during the pandemic. So yes, you're still going to need to do your emergency drills, and you're going to have to just do the best that you can. We know that, you know, it creates an issue with the physical distancing requirements. So, you know, we're just saying, do the best you can, try to maintain the physical distancing requirements. If you can look at, you know, staggering drills for different children to try to, you know, adhere to those physical distancing requirements. Obviously, if there is truly an emergency, like if you have a tornado coming to your facility or you have a wildfire and have to evacuate, like, we understand that in emergency situations, you're going to have to react quickly. But that's why it's important that you try to still, or you're required still to do those drills with children, and just try to do the best you can with the physical distancing requirement during those drills. So hopefully you can reach out to your licensing specialist and they can try to help brainstorm with you technical assistance, but we do still want you doing those drills to have the kids prepared in case, unfortunately, we could still have, you know, knock on wood, we still could have an emergency disaster happen even during the pandemic. The next thing, so I covered that we have the 120-day extension. Also, I wanted to cover that we will be updating our frequently asked questions and guidance. So some of the questions that came up were about transitions for age groups between classrooms, like an infant moving to a toddler classroom, a toddler moving to a preschool, so on and so forth. We will be granting a 6-month extension on ages. And this will be up to the program, whether you use that extension or not, but it will allow you the ability, if you want to keep a infant in the infant nursery past the 18 months because you want to keep them consistent with the group of children that they've been with, you will have the ability to do that. And then if, and I say 6 months or to the end of the pandemic, if you actually then have a toddler that wants to transition to preschool, and you can still do that, you could still transition that infant, but in order to support you and to keep those groups consistent, we will be granting that extension for you to use if you would like. A lot of programs have reached out to us and they really want to keep the infant with the group that they've been with, or keep the toddler with the group that they've been with. And so absolutely, we want to try to support that, but it is not a requirement that you keep them in that group. It will just be available to you to try to keep those consistent groups. It'll be available to you as an option.
And this is sort of new information based upon the amount of waivers that we've been seeing come in for providers asking if they can keep children in their classrooms longer for that consistent caregiving. So this, we have not even updated our website yet to reflect that. This is the first time that we've actually made this announcement. So we will be updating the website just as quickly as possible. But just to reiterate what Carin had said, in the past, we had requested that you submit a waiver for that type of situation, but based upon us trying to be as responsive as possible to providers, we decided we can go ahead and grant that 6-month extension.
Yes, and it just got approved yesterday afternoon, so that's why it's not up on our website yet, but we will be updating our FAQs to that. So it just is one more way the department wants to support you and try to give you some flexibility in meeting the requirements of the public health and executive orders. Okay, so good news on one form of water play that CDPHE has let us know is okay to do is the sprinklers. So you still can't have any other water play, no standing water, no water tables, no wading pools, but you are allowed to do sprinklers as long as you're still practicing the physical distancing of the 6 feet between children. So we had quite a few questions on water play and whether sprinklers would be allowed. That will be the one type of water play outside right now that will be allowed, would be the sprinklers with the physical distancing.
And Carin, do you mind, since we're talking about outside play, I see another question in the chat box real quick about playgrounds again and whether children can use playgrounds. Yes, they can use your playground equipment. You still want to do your social distancing as much as possible when they're on that equipment. But you can definitely still use the equipment. And just to reiterate what I said earlier, CDPHE is not requiring it that it be disinfected after one group uses it before another group comes out, or even at the end of the day as of now.
Right.
Also, I just got an email on my end that also is sort of on the playground side, but it involves outdoor sandboxes. Are they allowed to currently use the outdoor sandboxes? Because we know that the sensory tables are not allowed.
Yeah, I would say we can't answer that because we did not ask CDPHE, and that would really be under CDPHE purview if they would allow that. I'm going to venture a guess that probably not at this time, just because if they're not allowing for sensory tables, it would be the same idea, but don't take that to heart. We can certainly try to follow up with our partners at CDPHE. And Michael, I think you guys are going to try to set up a webinar in the future with them. But we can try to get that information, but that's something that's also not under licensing purview. You know, we really would want to get the guidance from them on whether they would allow that right now.
And I kind of alluded to this earlier, but the department is working on an additional toolkit because we know that there's just a lot of questions out there. And so I just wrote down Soundbox, and so we will talk to CDPHE, and maybe we can put this in part of our new guide or the new toolkit that we're working on.
Yeah, that would be great. So, you know, we tried to ask them to get guidance on some of the things that came up on here. There's some things that we were not able to connect with them about. And so some of your questions, you know, will have to be referred to them, but we're going to try to get you that information. And like I said, I believe in the future, Early Learning Ventures is trying to set up a webinar for you guys with our great partners at CDPHE. Yes, and it came up a lot about using the same space, indoor and outdoor, with physical distancing, and if you can have multiple groups. And that's the same indoors or outdoors. If you have the space, you know, for the physical distancing between groups and amongst the children in groups, you can certainly use those. You just want to make sure that those groups are physically separated into separate activities and are not combining any groups. A lot of questions about when we would have guidance for summer camps, both day camps and residential camps. The governor's office is looking to put out guidance on May 25th or 26th. So we should be getting guidance the end of this month, just actually in just a few more days here. Hopefully we'll have some guidance coming out on those programs, but we do not have any at this moment. We're waiting for the governor's office to give us that guidance, and I believe they're waiting on some information before they make a decision on those summer camps. Right now, building-based school-age programs are allowed to operate. So, you know, our school-age programs that operate out of a building for childcare purposes have been and are currently allowed to operate. So the decision that's coming out here in the next few days will be about the outdoor, mobile, and children's resident summer camps. Let's see. Another question that came up is programs can't do the field trips, and so they've been asking if you can bring outdoor vendors into your space, outside vendors, I'm sorry, into your space to do activities with children. Right now, CDPHE has said that is not allowed. They're not asking for any outside visitors except for essential personnel. So, you know, right now that is not, we would not like to see outside visitors into your program. There are some places that are doing virtual visits, like to the zoo and the museum. And, you know, with our screen policy, you are allowed to do, I can't, Debbie, maybe you can remember, or Tanya, what the terminology is, how we say for special occasions, I think.
Yeah, that's what it is. It's a special event.
Yeah, a special event. So if you wanted to set up a virtual trip to the zoo or to the museum or somewhere else for your children, as long as you're making sure the groups are social distancing and you're not combining groups or anything like that, certainly that would be a way that you could do something different with the children right now. Well, there's, you know, still the mandates from the public health and executive orders, but right now we're saying no outside vendors, please. And then let's see if I had any others.
Carin, while you're looking, I can answer a couple questions I see about the 6-month extension that we just talked about. So someone is asking if they need to get a waiver for this 6-month extension. And just to be clear, no, you do not. So if you have, let's say hypothetically, you have an infant in your infant classroom that's turning 18 months next week, normally you would start transitioning that child up to the toddler room. Because of the pandemic and because of the emphasis on the consistent caregiving and keeping children in the same consistent groups, the department just as of yesterday approved for us to grant a 6-month extension. So you don't have to submit a waiver to our department. You can continue to keep that infant up to 6 months. Same thing with the toddler. So as a lot of us know, when you have a toddler, you start transitioning them, they do need to leave. They need to be transitioned into the preschool room, typically by age 3. But you do have the discretion now to keep them in the toddler room 6 months after that. So that would be 3.5.
Yes. And I want to be clear, this just got approved very late yesterday afternoon.
Yeah.
So our licensing specialists have not even been informed that we're granting this 6-month extension without waivers. So this is very brand new information. Like I said, we're trying to get you the most up-to-date and current information as soon as we have it. But I want you to know, like, if you talked to your licensing specialist yesterday and they said you had to have a waiver for this, as of yesterday, you would have had to request a waiver. It got approved late yesterday afternoon. I wanted to make sure that you had the information on this call, but we have not even, that's why it's not updated on our website yet, and our licensing specialists have not even received that information. So they will be getting that today as well. And so if you contact them, they will have that information after today. But just to be clear, because sometimes, I'll get on a webinar, or Debbie or Tanya, and we'll have information that literally just came out, and like we said, we don't want to keep anything from you. As soon as we get information, we want to get it out to programs as quickly as possible. So sometimes, we may be giving you information that our licensing staff have not received yet. So in respect to them, I just want to put it out there that if you received any information yesterday about that you would have to do a waiver, that would have been correct information your licensing specialist would have been giving you, but we will make sure that they have this information today.
Yeah.
I have a small question coming in from the Facebook Live side of things that ties back to a question you answered, and it involves siblings. We were just seeking some further clarification. So when providers divide their children into groups of 10, is it advised that they put the siblings together to minimize exposure?
Yeah, that would be if they're the same age, if they can be combined in the same classroom for the same, like let's say you have a 3-year-old and a 5-year-old and they can be combined in a preschool classroom, absolutely it would make most sense to keep them together to limit their exposure to other outside kiddos. Sure, that would be definitely best practice. It's not, there's no requirement around that. Nothing in the public health order or executive order says you have to, but absolutely that would be a best practice if you can do that.
Thank you.
Were there any, and I think I covered all of them. So if you had a question that you put in early and it didn't get answered, it's more than likely because it's actually under the public health purview, and so we'll be trying to get that information for you. But were there any other questions that came up on the chat that we want to answer quickly?
There's one I can just answer really quickly, again with playgrounds and whether you can use portable equipment. Yes, you can use portable equipment, just a normal process, that's fine.
Yeah, no, it's really the soft materials that they don't want you using right now. So like your dramatic play stuff, your puppet, those things that you can't.
Non-porous.
Yeah, and the non-porous things is what you want to use, not the soft porous equipment.
Very quickly, just because there's been questions on both Facebook Live and over here concerning all the links that you provided. So just so everybody knows, we're going to be sending out a post-webinar message that will include a copy of the recording that has all the audio from our guest speakers. That'll also include all the slides, and when you're in the slides, you're able to click and follow all of the links. If you're on Facebook Live and didn't register for this, my coworker left a comment in the chat that includes where you can register for this. So you have, until about noon here when we send it off, when we'll pull the list. And then also, I am curious, Carin and Tanya and Debbie, about, best practices on signing in and out. Basically, are staff members allowed to sign the children in and out so that parents are not sharing clipboards, iPads, all that kind of stuff?
Yeah, so we have guidance on our COVID page about the sign in and sign out procedures and drop in, curbside drop off. And the more you can do, eliminate, the parent having to use pins or anything like that, the better off you are. And so, you want to check with, if we're talking about sign in and sign out requirements for like the child care assistance program or ELV, like you want to check with if you have certain requirements you have to meet based on the partners you're working with, you want to check with them about what their requirements are. But we do have guidance up on, the best way to do those. And you want to have, if you are having like staff sign in kids and sign out, you want to have a verification process with parents that, that they're verifying, yes, that is true and correct, but that could be done individually with parents. So you're not having them have to go to a sign in out sheet where you could be, transferring germs from, if everybody's using the same pen or same paper or those kind of things. So, but there is guidance about those procedures on our website, and whatever you can do to limit that contact on surfaces between individuals is the best practice.
Thank you.
Sure.
And we're actually, we're about to run out of time. So I do want to just make sure, one, to thank you all. I know that there are some fields that got busier, some that got, less busy. Licensing definitely falls in a much busier camp. And so, again, all of these resources are going to be available. We'll be sending them out to you here in about 30 minutes to an hour. For people that are not currently signed up for the licensing newsletter, is that just going to be easy enough from your website by clicking on one of the links, or is there a good place for them to go so that they can make sure that they're receiving your newsletter?
Yeah, so it is, if you go, and I provided a link in the slides, but if you go to the Colorado Office of Early Childhood website, so you see the Office of Early Childhood. If you go there, there's besides the whole COVID resource page, there's also information on signing up for our newsletters. And we actually have a Colorado Shines newsletter as well as an Office of Early Childhood newsletter. So I would suggest signing up for both of those if you haven't already done so. And also, to be clear, when we get out guidance to programs, even if you have not signed up for our newsletter, I mean, it's always great idea to sign up for our newsletter because we send out some really good information and resources. But also when we communicate about things like being, in compliance with public health orders or anything like that, we also use our listserv for our email addresses that we have on file for licensed programs. So we also send out a MailChimp to email to all of those programs as well, even if you haven't signed up for the newsletter. But I would suggest that anybody who would like to receive the Office of Early Childhood or Colorado Shines newsletter, please go on to our website and sign up for those.
Wonderful. All right. Well, we've passed 11, and I know you all have a very busy day in front of you. I wanted to thank you so much again for taking time with our network and with all providers. We'll be with you all shortly here with a copy of the materials that they provided. And then, Carin, Tanya, and Debbie, thank you so much for joining us. Do you have any last-minute things that you'd like to tell our providers?
Well, I'd just like to reiterate again, we thank you so much for your patience and understanding during this time, and how much we appreciate the services you're providing to both Colorado's children and families.
And thank you, Michael, for allowing us the opportunity to come in and talk a little bit. Again, I know we didn't get to all the questions that have been posed, at least in the chat box that I can see, and I'm sure there's additional questions on the Facebook Live. So continue to look for more frequently asked questions on our website, and we are in the process right now of developing a little bit different platform for this, for our new revised toolkit.
Wonderful. All right, well, we will all stay tuned with excitement. And as I said, we'll be in touch with you all shortly via email. So thank you all for attending, and I am going to be closing the meeting now. So thank you all.